Okay, thanks for joining us again. Today we have James MacFarlane presenting another new scientific study published in the Journal of the European Society of Photobiology. The subject of this one is photoaging, and it also gives you a bit of a sneak preview into a new product which will be launching in New Zealand mid to late 2022. So we'll see you there.
Another important indication that we have for Fernblock is photoaging. We know that photoaging is probably in many markets the most important indication. We know that in Asian markets, skin cancer, for example, is not a primary issue the way it is in many European markets. That Asian population is concerned primarily about the aging effect and the hyperpigmentation effect of solar radiation. And this is a review that came out just last week. It is from, as you can see, a very important group of American dermatologists. One of the authors is Henry Lim, also Dr. Kohli and Dr. Hamsavi, so recognized international leaders in photoprotection. It's been published in Photochemical and Photobiological Sciences, which is the official journal of the European Society for Photobiology. Okay, so we have key international opinion leaders studying Fernblock in photoaging with a publication in the European Society for Photobiology. So this in itself is very important. It is not a study, it is a review of the available studies to see whether or not effectively there is sufficient evidence to support a claim of Fernblock in the reduction of photoaging. And of course, the conclusion we'll see is that Fernblock reduces photoaging induced by UV and visible light. Okay, and here what's interesting is that in addition to ultraviolet, they're talking about visible light as if it's a normal part of photoprotection, important to protect against it as it's important to protect against UVB. So, sorry, go back one.
Yes, sorry, James, just click on the slide and go back.
Okay. So we have, as you know, numerous in vitro, animal and human studies which have demonstrated Fernblock's efficacy in reducing photoaging induced by ultraviolet and visible light. Okay. We know that ultraviolet and visible light alter the extracellular matrix. Okay, the famous ECM. The extracellular matrix is everything that helps to provide firmness to skin to prevent the development of lines and wrinkles. What happens is the UV and visible light damage fibroblasts and increase the expression of MMPs. You'll remember that MMPs are enzymes which degrade collagen and elastin, leading to wrinkles and loss of firmness. UV and visible light, as you know, also stimulate melanogenesis, which can lead to hyperpigmentation, spots, melasma, and uneven tone. So photoaging through alteration of the components of the skin by damaging fibroblasts, reducing collagen and elastin, but also increasing pigmentation. We know that Fernblock has antioxidant and anti-inflammatory properties, which can help to protect the fibroblasts, decrease MMP expression, and regulate the extracellular matrix proteins such as collagen and elastin. It also reduces pigmentary response. So we have a full body of publications demonstrating its activity, and this article provides a comprehensive review of all studies investigating the efficacy of Fernblock in reducing photoaging induced by UV and visible light, concluding that it is a suitable adjunct in combating UVR and visible light induced skin aging, both topically and oral. Okay, so the conclusion is very important. Dr. Henry Lim and his colleagues are writing that Fernblock is a suitable adjuvant in combating UVR and visible light induced skin aging. Okay, so not just Cantabria Labs is saying it, not just various studies, but having examined all the studies, international key opinion leaders are saying it as well. And what they do is they go through all the published evidence regarding Fernblock. So going through all the studies, they look first at photoaging induced by UV. And what have we demonstrated through our studies? That Fernblock is able to increase the survival of fibroblasts, increase the proliferation of fibroblasts, and preserve its morphology. Okay, so the source of the collagen, elastin, hyaluronic acid, all the components of the extracellular matrix, the fibroblast, is protected and healthy, and it helps to produce collagen, elastin, and fibrillin. Okay, so not only does it help to protect, but it has an active role in replenishing components of the extracellular matrix, making it an excellent anti-aging product independently of sun exposure. At the same time, it reduces inflammation, reactive oxygen species, MMPs, and melanin production. Okay, so studies Fernblock in UV have demonstrated these activities. This is a mistake. This should be induced by visible light. Okay, so we looked in the previous slide at UV. Here we have visible light, and again, studies have shown that it increases the expression of elastin and fibrillin, components of the extracellular matrix, and decreases inflammation, MMPs, and melanin production caused by visible light. Okay, so all the evidence that we have available, their conclusion is, as I said earlier, Polypodium leucotomos extract, and previously they specifically mentioned Fernblock, saying that all studies in the review except one are based on Fernblock, is a well-tolerated and safe agent with photoprotective properties, making it potentially a suitable adjuvant in combating UV radiation and visible light-induced skin aging. So what does this mean for us in terms of marketing? It means that HelioCare topical photoprotection provides additional anti-aging benefits versus other sunscreens. Okay, as we always say, other sunscreens of the competition are very good. They have good filters. They provide good protection. They're nice to use, but we're able to give the doctor, pharmacist, and patient something more because of Fernblock. And here we have specifically demonstrated that we are providing additional anti-aging benefits. This is topically that oral photoprotection can boost the anti-aging efficacy of topical sunscreen. Okay, so a very nice way to return to your doctors to talk about the role of Fernblock in preventing skin aging. So how could we use this? Well, as I said, to remind doctors and pharmacists of the efficacy of Fernblock in preventing photoaging induced by UV and visible light, endorsed by key opinion leaders, Dr. Henry Lim, in the Journal of the European Society for Photobiology. So maybe it's been a while since you've talked with your doctors about the Fernblock in photoaging. This is a good excuse to return to them with something new, with an important publication reviewing all the available data. So to remind doctors about its indication in photoaging. If you want to use it as an excuse to focus on recent anti-aging studies, which maybe you haven't had time to present to the doctor, we have 3 interesting anti-aging studies. We have the 2021 Portillo, where we looked at Fernblock and blue light. The Schalke 2019, where we looked at the ability of Fernblock in topical formulations to increase protection of MMPs. And then in 2019, Mohammed Sempre, always in the group of Henry Lim, looking at photoaging and visible light specifically. Okay, so you can use the review as an excuse to go back and focus on the more recent anti-aging studies. And all this, of course, is excellent support for the introduction of the HelioCare 360 Age Active. Okay, a formulation we have specifically developed for patients with advanced skin aging or with particular concerns regarding skin aging, particularly the development of lines, wrinkles, the development of sagging. Okay, so product Age Active with supporting bibliography of Fernblock's efficacy in protecting against aging. So again, very interesting, very useful. And just the
Okay, well, there was a little bit of behind the scenes there. You know what we get from Cantabria Labs, which we are sharing directly with you. A quick note on Dr. Henry Lim. We do have another video where he presents the effects of Fernblock on photobiological changes in the skin. So I will link that at the end of this video here, which you should see pop up. And we'll see you on the next video. Bye.